Good afternoon. And here today, Chief Pena, Chief Acevedo, Mayor Pro Tem Martin, Dr. Purse, and we're going to get started. Let me just start off by saying that I hope everyone had an enjoyable Thanksgiving, and I know for most of us it was different than normal, but hopefully it was an enjoyable one for everyone. Let me give you the numbers for today. The Houston Health Department reports 685 cases of COVID-19 today, bringing Houston's total to 97,703. November was the second busiest month at Houston Health Department affiliated COVID-19 testing sites. More than 90,877 people tested between November 1st through the 28th. I want to thank everyone for getting tested before making your holiday plans. And so that's good news. It was our second busiest month for testing, and hopefully that will continue in the city of Houston. I encourage those who have traveled, those who have traveled, like my friend to the right, those who have traveled or been in the presence of those who have traveled to get tested. Okay, so a lot of people traveled this week, and a lot of people had people who traveled to their homes. Let me encourage both groups in the next few days to get tested. That will benefit all of us as we move forward. With regards to the positivity rate for today, the positivity rate in the city of Houston is 8.4%. And this was going through yesterday, November 29th, which factors in today. That is down slightly from last week's positivity rate of 8.8%, but still higher than where we want to be. So that is a bit of good news. It's a snapshot in time. So the positivity rate is 8.4%. Last week it was 8.8%. And again, we will see how things unfold over the next 2 weeks. I simply want to point out that the things that we have asked people to do, if we do them collectively, do them together, they certainly can work. So this is just a moment, a snapshot in time, and I'm going to ask people to continue to adhere to all of the protocols as we deal with COVID-19. I would not be surprised if we see another uptick post-Thanksgiving with all of the family and friends gathering, people traveling, and reports of crowded establishments in our area. As I said over the weekend, I am watching the numbers carefully. A lot of what we decide to do going forward will depend on people's behavior, the extent of the community spread, and the status of our healthcare delivery system. And so, again, let me ask you to avoid crowded spaces. If you walk into some business establishment and you see that it is just crowded, people standing shoulder to shoulder, especially without any masks on, then I would ask you to simply turn around and move in the opposite direction. Fortunately, today, again, a bit of positive news. For today, there are no new deaths. We are reporting today, and so the total number of deaths in the city remain at 1,436. Again, this is just a moment in time, and all of these numbers are subject to change tomorrow, next week, and the days and weeks to come. But over the holiday weekend, we announced the sad deaths, though, of 2 City of Houston employees due to COVID-19. I want to take a moment to acknowledge both and offer my deepest condolences and prayers to their families, friends, and especially those that they work with on a daily basis. The Houston Public Works employee, Joel Casarillo, passed away on Wednesday, November the 25th, after fighting COVID-19 in the hospital for the past week. Casarillo Joel began his career in the Code Enforcement Division on May 12th of 2014. His wife is also an HPW employee. I had the privilege of speaking to her on Saturday, Veronica, who is also a public works employee. She told me how much Joel loved his job and his co-workers, and he wanted to be able to wear a shirt that said, "I survived COVID-19. But sadly, he did not get a chance to do that. With your help and your cooperation, others can wear the shirt that he is not able to wear himself. And then last Friday evening, the Houston Police Department announced Senior Officer Ernest Leal Jr.'s death due to COVID-19. Officer Leal joined HPD in 1984 and served with commitment and compassion, a great deal of pride and dedication to our city. In city government, we mourn for public servants who died. That includes 9 municipal employees, 3 Houston firefighters, and now 1 Houston police officer who have died because of COVID, because of the virus. Now, let me bring up Chief Acevedo to talk more about Senior Officer Ernest Leal. Chief Acevedo.
Thank you, Mayor. Thank you for having us, and thank you for your continued leadership, and obviously for trying to keep our community safe and our first responders safe by really encouraging people to wear their masks and to proper socially distance and proper hygiene and to wear the mask appropriately. I see a lot of this. This doesn't do us any good. We've got to wear them covering the nose and the mouth, and if you're going to wear them right, because it's kind of like wearing a seatbelt under your armpit that when you crash, you smash your face. It doesn't do the job as effectively as it can. Senior Officer Leal, first and foremost, I want to thank the community on behalf of Dee, his wife, and his extended family for the prayers. We know that we believe in the power of prayer. We know that the Lord's will was done, and he's in a perfect state. He's a man that served for a lot of years. Very community-oriented officer, understood the relational policing, the concept of relational policing, and I can tell you he was so loved that the community actually came out to the hospital to, from the outside, serenade him and his family and offer their support. His services will be later on this week, I believe, Wednesday and Thursday. Wednesday will be a visitation and a rosary. It's very limited space. We'll put out some information. And then Thursday will be the actual memorial service again, and limited spacing because of COVID. We are unfortunately trending, and we are part of the community, and this is important for the community to know that we, as of October 1st, we had 32 members of the Houston Police Department that were positive for COVID, Mayor. On November 1st, that number went up to 53 that are positive, and as of today, we're up to 89 members of the department that are positive. So we're trending upwards. We have had some very robust protocols in place, but I'll be real honest with you. I put out a message to my command staff. I think that human nature being what it is, people get a little lax, and I've made it real clear to my people that if I see a police officer out on the streets not wearing a mask, there are going to be consequences. There are going to be administrative consequences because we do not want to lose another member of our family. And so the last thing I want to talk about is bars and establishments where people are not doing the right thing, some of the bar owners. I have directed our Vice Division to start making visits on these complaints of individuals, of community members. You are our eyes and ears. If you see establishments not doing the right thing, please let us know. Our Vice Division is out every night, and we'd like to investigate those locations. Because at the end of the day, what we want to do is save lives. And the only way we're going to get through this sooner rather than later is if we all follow the public health advice, the mayor's advice, and obviously follow the rules and the protocols that have been established. So thank you, Mayor, and that's my brief for this afternoon.
Thanks, Chief. Chief Pena.
Thank you, Mayor. Good afternoon, everyone. I want to give a brief report on the numbers for the fire department, and As my colleague, my partner has mentioned, our numbers are trending upward as well. Today we're at 130 firefighters that are in quarantine. We have 36 firefighters that are positive with coronavirus today. We've had a total of 352 that have been tested positive since this pandemic began. I want to take a little bit more time to expand on what the mayor has mentioned and what the police chief has mentioned in regards to the occupancies and the crowding in some of these venues. The Houston Fire Department has responded to nearly 20,000 complaints since March 18th of this year for occupancy and enforcement of the governor's order. That's about 90 to 100 complaints per day that we are receiving. And the majority of those complaints are handled on the spot. The business owners and the management has been receptive. They've been accommodating and allowing us to help them achieve a safe space. But in the end, look, we want to help these businesses keep the lights on. We want to help them have a safe space for their employees and for their customers. But we do need their assistance in ensuring that we are enforcing the recommendations made in the governor's order as far as distancing and spacing. You probably saw on social media the club that was trending this Wednesday and this weekend in regards to overcrowding at one of the local venues here. The problem that we're seeing is that venue itself, the occupancy, the normal occupancy it's over 1,100 occupants. So even if they limit it to 75%, we're talking over 800 people in one room, okay? That makes it they're still in compliance, but it makes it very difficult for us to ensure that they're properly physically distancing, social distancing, and maintaining those recommendations as we've been mentioning. We do ask the business community to help us in enforcing the physical distancing mandates in the governor's order. We will be a resource to these businesses to help them attain that safety. But again, our goal is to help you stay in business, keep the lights on, and provide a safe space for your employees and for your customers. But we are going to need the community's help in ensuring that we do that. The mayor has mentioned it over and over. We're asking the community to please follow the recommendations as outlined in the CDC, Dr. Peirce, and the Health Authority. And they're very simple. These are the best recommendations that we have at this point. Wear your mask, proper hygiene, and physical distancing are the key right now. The vaccines, we're anxiously awaiting those vaccines. It is going to be a huge, huge boost and help to the public safety. But for right now, the best recommendations, and even when the vaccine arrives, by the time we get everybody vaccinated, those who want it, these are still going to be the best recommendations for the near future. So we ask that you will help us. We, again, will be a resource for this community, and together we're going to get through this pandemic safely. Thank you.
Thank you, Chief Pena. And we are trying to strike a very delicate balance in protecting the public's and the community's health, and at the same time wanting to keep businesses open. Okay? So it's a very delicate balance. And we're asking people and businesses to work with us, and, you know, I know my staff is trying to work out my schedule in terms of me kind of getting out and about and take a look at what's happening in some of these establishments. These bars now serving as restaurants, these clubs. And so if by chance you see me coming in, I'm not coming in there for a drink. I'm coming in there to take a look for myself because we have limited options, which means as I go about the city and come into your establishments and see that it's nothing but a community spreader event, then the last resort that we have as local officials, at least within my arsenal, is to impose a curfew that will just shut it down at a certain time. Don't want to do it, but we are concerned about these rising numbers what's happening within our hospitals, and doing everything we can to keep people across the board safe. So if by chance you see me coming in there, it's not to come in there to have a drink and to socialize with you. It's coming in there to see what you're looking like and whether or not people are in there with no masks on and crowded together, and it's a community spreader. And if we see that happening all throughout our city, then you're simply not going to leave. You're not going to leave us with too many options. So please just consider yourself forewarned. Having said that, let me bring on Dr. Pearce.
Thank you, Mayor. And first, condolences to Officer Leal's family and the entire HPD family. It's we have to consider that every COVID-related death was a preventable death. Everyone who gets infected got infected by somebody else. Now, certainly nobody infects someone else on purpose, but surely somewhere in that chain of transmission, it could have been broken had somebody distanced a little more, wore a mask, washed their hands. So every death is preventable, and we need to consider it along those lines. And we look at some of the data that we've looked at. The mayor's already illustrated that the positivity rate this week is actually down a little bit from last week, which is good news, but it's still at 8.4%, which is way higher than our arbitrary goal of 5%, which is still 5% too high, right? But it is down a little bit. So I think what we can take from that is that some folks are paying enough attention that we've seen a little bit of a fluctuation in the data. I also want to, on this slide, you will see the bar graph, the vertical lines. That reflects the number of people who've been tested. So I want to thank and congratulate the Houstonians who've gone out to get tested, because if we're now seeing, we've been saying that about 40% of folks who are infected have no symptoms, but as we've seen the age of the average infected person go down, the younger you are, the less likely you are to have symptoms. So there are now estimates that the number of people, the percent of people who may be infected may be actually as high as 55%. And so, again, if you're one of those folks, the only way you'll know is if you get tested. So please go and get tested frequently. Now, the other thing is when somebody gets, we go to the next slide, I think. The other thing is that we need to keep in mind is that one of our goals all along, if you go back to last March, when we first started talking about this in January and February, one of the things we want to do is protect hospital beds. So that if somebody was ill and needed a hospital bed, there would be one available. So this slide, that 12.7% reflects the hospitalizations in Harris hospitals in Harris County. So currently, as of today, or actually this is yesterday's data, November 29th, as of yesterday, 12.7% of the ICU and general bed hospital beds are filled with somebody who is diagnosed with a COVID-related illness. They're COVID positive. That's why they're in the hospital. So, if you think about it, what that does, that displaces. Hospitals generally run at better than 95% occupancy, sometimes 98, 99% occupancy. So we're getting to that point where a significant number of folks are not having hospital beds available for them what they need, whether it be a COVID or it be a heart attack. And so another big reason why we need to move things in the other direction. And the other thing you'll notice is that pink graph on the top goes way back to the beginning of all this, and that peak there right where the 12 is, that's July. And off to the far right is current. And you can see that curve is going up, much like it did before the peak that we had in July. So we need to change things to drive the numbers down, do everything that the mayor and both chiefs have said. By the way, I want to thank both chiefs for you are excellent public health disciples and getting the word out, and thank you for doing that. But they've said all the right messages, and so we can't control this. We absolutely control this. We've done it before. We just need to do it again. 12.7% is way too high. I'll remind you that in one of the governor's orders, at a 15% hospital occupancy value, part of his order changes. It really particularly goes to schools and them getting testing. But these are somewhat arbitrary values. But I did not think we were going to see 15% for a long time, and here it is. We're at 12.7% and moving in the wrong direction. So let's get together. Let's get serious. One more time, let's get serious and change the direction of these numbers. Mayor.
Thank you, Dr. Pearce, and I do want to thank the thousands and thousands of Houstonians that did do what we asked people to do. They kept their Thanksgiving dinners small, and they did adhere to the protocol. So let me thank you. Let me thank the many businesses who are doing the right thing and cooperating I want to thank you as well. So let's just keep it up. We're too close to when the vaccine will start to be distributed. So let's just be patient and let's continue to work together. And my goal is that we can continue to drive the positivity rate down and then start seeing the number of hospitalizations, that number start going down as well. We'll take questions from you.
Mayor, I've got a few questions here from KRIV. First question, do you worry that those who've traveled are now possibly unknowingly bringing the virus with them to work or school?
Yes, I think you almost, and I can't recall which doctor I heard say this, you almost have to assume that if you were traveling about, flying about all over the country, that you were susceptible to either carrying the virus or picking it up and now bringing it back. And that's why we want to encourage people in the next few days to go and get tested, just to know. To protect people who are around you and that people that you will come in contact with.
Would you encourage people to stay indoors to mitigate the spread in the colder temperatures? And what advice would you give Houstonians? Because we've all heard how the virus can thrive in colder temperatures.
Let me yield to Dr. Peirce on that. I think he'll probably be in a much better position to speak to that than I am.
Thank you. So, Andy, this is a really good question because the point is, we do worry in colder weather. Remember back in the beginning, there was this big hope that when it got warmer that would hurt the virus. And we did see, mathematically, we already see, it did change the R value a little bit. So the weather doesn't really, so getting cold isn't a huge advantage to the virus in terms of the temperature. But what is a huge advantage to the virus is instead of us socializing outdoors, people will be socializing indoors. And so it goes back to the idea, if you really can't be socializing with folks outside your bubble, indoors. And if you're doing it outdoors, you need to social distance, which is easier outdoors, right? Let's face it, it's just a lot easier to do that outdoors than it is indoors. And that's the problem, is that people will want to socialize with folks outside their bubble, indoors, where you can't distance as well. And that's going to be the problem.
So can a cold front really impact COVID cases here, or is it more places that stay cold for longer periods of time?
So I don't see that the weather is going to impact how the virus behaves. The weather impacts how we behave. I think that's the big difference. Does that make sense?
Yeah.
Weather changes how we behave. It has a small impact on the virus, not huge, but it has a larger impact on how we behave. And unfortunately, it causes us to behave in ways that is an advantage to the virus.
So the dip in temperatures won't really have an impact on COVID rates or flu rates?
Oh, well, I think that we're going to see it go up. So, it's like a two-level question, what you're asking. So, yeah, unfortunately, I do think that the change in behavior of our folks is going to cause it to go up. We see that with cold and flu every year, right? It's the same phenomenon. But this is what the message to the public is, that if you're going to be indoors more, then you need to stay within your own family bubble and not be inviting folks from other family bubbles over to your house to watch TV or play cards or do whatever, because that's the problem. What you may have done that over the summer in the backyard where there was a good breeze, and that wasn't much advantage to the virus. But now when you do it in your living room, that's exactly what the virus will take advantage of.
Thank you so much. Mayor, got a quick question here for you. This is cold weather related from Channel 13 regarding any possible plans to assist the homeless with temperatures expected to dip close to freezing, and after a woman was found dead near U of H. Yeah,
and in fact, we've got efforts that are going on directly now to address the needs of the homeless that are on our streets. Mark Eichenbaum is providing leadership to those initiatives. We're working with the Coalition for the Homeless. In fact, we're using a significant amount of our COVID dollars just to address the needs of the homeless as well. So we're very sensitive to the people that are on the street. The Health Equity Response Task Force, the HER Task Force, is also channeling many of their efforts to address the needs of people who are on the streets. So the answer is yes. And I would say, just to your last question, the temperature in Houston is significantly different than the temperature, for example, in Boston or New York or Chicago. So cold for us is in the 50s, 60s, low 70s. That's cold for us. But for people who are coming, from these other areas, it's mild weather. So even our type of cold, you can still be outdoors. You ride your bicycle a little while, you're going to warm up. You jog a little bit, you're going to warm up. So that's one of the benefits of being in Houston, Texas.
Thank you.
Sure.
Chief Pena, quick question for you regarding enforcement and breaking the occupancy
Sure.
stipulations that have been set out. What kind of, when you're working with a lot of these business owners, what are a lot of them telling you in terms of why they're not abiding by the governor's order in terms of the occupancy rates?
Yeah, a lot of them is just, to their comments is lack of understanding of what the requirements are. Once our inspectors and our investigators are there as a resource to try to educate and advise on those requirements, 99% of the time we'll get compliance. There are times where we don't get any compliance. Certainly, the governor's order is pretty clear. If it's a bar, it should not be open, okay? And unless they're transitioning to restaurants. So that's a conversation that's had on an individual basis. And as I mentioned again, we've responded to almost 20,000 of these complaints. So it is time consuming. The difficulty we're having is that we're limited in our enforcement. The only enforcement we have right now under the governor's order is just referral to TABC on those that are non-compliance. When the governor's decision was made to allow, or the TABC's decision was allowed to allow the business to remain open as they transition from a bar to a restaurant, that really opened up the floodgates as far as the number of occupancies that are applying for that transition. And so it's the demand is going up. And so again, what we're asking for is for the businesses to assist us in providing or meeting the recommendations that are outlined. Limiting the number of personnel inside the business is one thing, but the physical distancing inside the building, that's what we need the assistance of the management for. Because as I mentioned, the club that we were talking about here earlier, their occupancy allowed them to have legally, under the governor's order, it allowed them to have close to 800 people inside that building. If they're all crowded together, that's the game changer. So, being able to meet those requirements, the distancing requirements, that's what we need the business community's assistance with, and we will be a resource to help them get there.
Thank you.
Okay. Anything else? All right. Thank you all so very, very much, and we'll talk soon.